So for Materia Medica, we'll be doing three drugs for today. That is Ficus religiosa, and then there is another remedy, Ficus indica. Actually, both belongs to two different families, but the therapeutic action are almost similar. So that is why in your syllabus it is Ficus religiosa, I think. But I thought of discussing also about Ficus indica and also fluoric acid. So, starting with Ficus religiosa, its common name is actually used as a low potency tincture form. It's also called as peepal tree, and sacred fig or pakur. Natural order of family is Moraceae. The part used, the juice of fresh leaves mixed with equal parts of alcohol. It's usually used as a tincture, and the plant is actually this one. So in the temple area in India, we can see this tree actually. The next one also Ficus indica or Ficus bengalensis. That is also similar in look. Like this will be the Ficus bengalensis. Uh, but this is actually the banyan tree. Almost they are very similar to how it grows. It grows like in a massive width, and it is this one. Uh, the Ficus religiosa. It is considered to be highly sanctified. In the temples, we have this tree. Some religious connections also, belief also kept associated with this tree. So the prover is actually, because this is an Indian medicine, the prover is also an Indian, Dr. Sharat Chandra Ghosh of Medinapur, West Bengal. He made the first proving, and in the proving, it was mainly found out that this is a very good remedy for hemorrhages of any kind. That was the indication. So in one of in Judge Clark, he had anecdoted that Dr. Ghosh had sent him, John Clark, a supply of this remedy, and after to that, John Clark, he had very satisfactory results with the 1x potency in controlling menorrhagia. The provers were Dr. Ghosh himself, his wife, and also his dog. Have you, any one of you, heard about Ficus religiosa before, or do you have any clinical experiences with Ficus religiosa?
No,
Yeah, so
because
this, hmm,
because hemorrhages, mostly the cases that I have seen,
mhm.
some are the EPEC, some are phosphorus, some are arsenicum. But not so never see this before, never experienced.
This is actually an Indian medicine only, and also usually given as tincture. But other than exam importance, I don't know, because personally I'm not that much fan of these tinctures. I have never understood the exact what is that, how to differentiate these tinctures, because if we go and open the medical boric textbook, almost all the symptoms will be similar. So how it can be differentiated is very difficult. Now, when we see Ficus religiosa and Ficus indica, we can see that the hemorrhage in both are same, bright red hemorrhage, and one is more anti-hemorrhagic than the other. That is the only difference I could see. Otherwise, the symptoms that both cover are almost similar. So anyway, this is a hemorrhagic remedy. Both Ficus indica and Ficus religiosa, both are hemorrhagic remedies, and bright red hemorrhage is the one. So bright red, because we have other remedies as leniolisotolma, who spoke now, like phosphorus, millifolium, aconite, belladonna. Belladonna, it won't come out as much, but mostly they are also the bright red active type of bleeding that is happening. So when we have that potencies, why should we give tincture? I never have an answer for that. and hence I'm not that huge fan of tinctures, or rarely I use tinctures. With the clinical conditions, it is a anti-hemorrhagic remedy, good for epistaxis, menorrhagia, metorrhagia, hematemesis, dysentery which is mixed with blood, hemoptysis, hematuria, bleeding piles. So any condition where there is bleeding from the body, and the only condition is that the blood should be active, bright red in color. In mind, there's so many symptoms that has been given in the boric, but how much they will be, I mean, the people who are prescribing, they will follow this. I'm not so sure at all. However, in mind, there is unwillingness to move the person, to move physically also, maybe because of this much hemorrhage that is happening. So they don't want to move about, and then bring a increase in or an aggravation of bleeding, maybe that, though it is never told in anywhere the aggravation of bleeding can happen due to movement, it is not given, but still in the mind the person is unwilling to move. They're very sad and melancholic and very much sensitive to noise. There will be headache with hemorrhages, any kind of hemorrhages, and along with that, if there is headache, there will be burning at vertex, nausea, vertigo, etc. In nose, epistaxis. Mouth, there is vomiting of bright red blood. White tongue with profuse saliva. And stomach, also there is vomiting of bright red blood. Great repugnance to all foods. There is a sick feeling in the stomach. We already told that there can be nausea also, and also the vomiting. So there will be a sick sensation. In the stool, there is a bloody dysentery. In urinary organs, there can be frequent desire to micturate. The urine contains much blood. Female sexual organs, it can be menorrhagia or metorrhagia, but the thing should be the bright red blood with a bearing down pain in lower abdomen. In respiratory organs, already we saw that it is good for hemoptysis, so difficulty of breathing, inclination to cough, causing him to spit blood, and that should be bright red blood. So although this much symptoms has been given, put in a nutshell, what we get the characteristic is any kind of hemorrhage, and the blood should be bright red in nature. And the bright red bleeding that is happening from any orifice of the body, one of the tincture they could give is Ficus religiosa. Potency of choice is mother tincture 3x, 6C, and also 30C. So usually the lower potency, but I don't know even in India whether we will get 3x, 6C, and 30C. I don't know. I know mother tincture is available. Other than that, I have never seen, even in my college days also, I have never seen any of my professors prescribing this medicine. The second one related to that is Ficus indica or Ficus bengalensis. Common name is banyan tree and natural order is Urticaceae. So the family has changed. The other one was Moraceae and this one is Urticaceae. They don't belong to the same family also. But botanically, some other similarities though with regard to the leaves appearance, and also the growing in tree girth. It's wide with similar growth can be seen, though they are belonging to two different families. So this one, the Ficus indica, it possesses a greater anti-hemorrhagic property. Sorry, not just hemorrhagic, anti-hemorrhagic property than Ficus religiosa. In case, I mean, the only difference that here also, as I told, the blood color, it should be pure red. So that also similar. Hemorrhage before any evacuation or can be bloody leukorrhea. The thing is, the Ficus indica is more anti-hemorrhagic than compared to the Ficus religiosa. And the bleeding nature, bleeding tendency in both the drugs I mean, not the bleeding tendency, the blood nature, both the drugs are bright red in color. So regarding the hemorrhagic property, this Ficus indica, it successfully arrests hemorrhage from piles, mouth or throat, or in chronic blood dysentery, hemorrhage during menses or before any evacuation or even bloody leukorrhea. And seriously, I never understood because when you take boric, you will see that there is a section towards the latter parts of this boric saying Indian remedies, and mostly it is about the tinctures actually. Some tinctures, yes, it is useful. We can say like that. Some tinctures are useful, but many of the tinctures I have never understood what was their use. Why did they actually prove this medicine also? Because and even when we proved who is using these medicines when we have other potencies, I really don't know. Anyway. And ficus indica, yeah, this is having some symptoms regarding the gonorrhea also. Gonorrhea and diabetes, which is associated with burning sensation during urination. Uh, However, I don't think this medicine is ever given for diabetes. I have never heard so. Nervous debility due to seminal loss and copious hemorrhage. So both the drugs, Ficus indica and Ficus religiosa, for bleeding condition from any body parts, any orifice, one is more anti-hemorrhagic than the other, and that one is Ficus indica. And the nature of blood in both the remedies are same, that it is bright red in color. Then we go to the main medicine of today, that is fluoricum acidum or fluoric acid or acid floor, however you say that. Common name is hydrofluoric acid preparation made by distilling pure fluorspar or calcium fluoride in a state of fine powder with sulfuric acid. So sulfuric acid when treated with calcium fluoride, that is how the fluoric acid is produced. Then clinically, have you heard about fluoric acid or anyone of you prescribed fluoric acid? There are more chances of this being prescribed.
Uh, I got prescribed for a keloid case.
Keloid cases. There can be incrustations. There can be, and how was the change? You know, I mean, which potency you
Um,
gave for how long?
I gave 30 the first 2 weeks there was reduction on two areas of the keloids.
Mhm,
But some symptoms of the past have come back, like a lot of irritations, some gastric problems, which she used to have actually.
mhm,
Um, but the indication was given because there were night burning sensations as well.
mhm,
Um, and a few other symptoms I can't recall. I need to check the case. But the irritations then later as a follow-up, um, it was quite severe actually. So she had to go to the clinic, get MC and all. So I was a little concerned on the aggravation part, or whether it was. But since she had it before and then it came back, so stomach pains, it was also one of it. But of course, after that, then it subsided. Um, and then the problem is that she is scared to take the remedy again.
aha, okay.
So she didn't show, she wasn't keen to continue when I wanted to repeat.
Okay. So how
Yeah,
did you give fluoric acid in powder or was it in pills? How did you give that?
yeah, I gave in globule, one globule.
Okay. And one globule produced your symptom to come back.
Yeah. I mean, the remedies, the medicine is there, but yeah, it did. The rest of it was placebos for two
Actually, it
weeks.
is when we go through it, you will see that it is a very deep acting remedy. Okay. So after that, did you see the patient again?
No, no. In a way, a conclusion is I lost the patient because the patient is scared to continue with.
Okay. I mean, I was
Yeah.
asking like whether it was a non-person or someone, like just to see, no, not whether the patient took the medicine again or not, but were you able to see the patient again like a common relative or something? So the size has
Oh
been
no, no,
reduced.
no.
No, nothing, nothing.
Yeah,
Okay.
it was introduced by a friend. So
Okay.
yeah.
So your main indication to give fluoric acid was that heat sensation, was it?
Uh, I got to check. There was some night burning pains. Some
Mm-hmm.
because
There is night
s-
burning in fluoric
there
acid.
was yeah some pricking as well. Some
Oh,
kind of pricking sensation. But the thing is, I gave Silisha the first before prior to that. Okay, didn't have an effect actually after waiting for 2 3 weeks, and um so I checked back again, and then I looked up, and then I concluded it fluoric acid due to some reasons. I need to check the case.
okay. Fine, fine. Anyone else who is having any experience with fluoric acid? Lenny?
No, never tried before. I have very coarse vein cases, but not the totality is not fluoric acid.
Mm-hmm.
Yeah, that case is arsenicum case,
Okay.
but it's very coarse vein, very serious.
Mhm. Okay.
Yeah,
So
but I didn't give fluoric acid because it is not in totality.
okay. Even
Yeah.
I have not given fluoric acid anyone. In my memory, I don't remember giving fluoric acid to anyone. Uh, okay, going towards the clinical conditions, it can be given for alcoholism, alopecia, or hair loss, bone affections of cicatrix decubitus, the decubitus ulcer, fistula, locomotor ataxia, nymphomania, or satyriasis. Satyriasis for that will be increased sexual desire in males. Syphilis, teeth defective, toothache, varicoses, veins disease, or any type of vein disease. So when you go through these clinical conditions, you will understand it's such a deep acting remedy. It is going right through the constitution of the inside, the core of the body, we could say, because there is bone affections, the cicatrice or the keloid, we not mentioned, the decubitus ulcer, fistula, locomotor ataxia, where the nerves, the bones had been affected, the tooth, then also the sexual sphere. So this is actually a very deep acting remedy, and like because this is a acid, it is also having the common feature of acid. Like acid, it means whenever acid, in case it is falling on body, it is going to cause the destruction of that area, and depending upon the concentration, it can even completely burn that tissue, even the bones actually. So such type of destruction, the destruction that is happening in the mental also level, because we'll see fluoric acid, they are one of the worst um, type of people, especially when it comes to in the sexual sphere. There is no morality for them. So we could see such a destruction even in their mental or the emotional level, and also in their physical level. So, characteristics, it acts especially upon the lower tissues indicated in deep destructive process, the bed sores or the decubitus, ulcerations, varicose veins, etc. Patient is compelled to move about energetically, and he can also actually move about very energetically. Here the statement is given as patient is compelled to move about energetically, but actually he will be very happy to move about. Actually, in that manner it can be compared with the remedy we told for acute mountain sickness, copper. Even coca is so energetic, and that is why it is going the person, the constitution, the coca medicine, the person, he is actually socially secluded person. And this I'm saying about coca, okay? He's a socially secluded person. He doesn't want to be in the society, and then he wants to go away somewhere, and he prefers to go into the mountains. Or we can connect it to the mountaineering type people moving about. The physical exercise is not a big problem for them. They have got a lot of physical endurance. In case of coca, with that feature of coca, fluoric acid is compared. So even fluoric acid will be so happy to do this much strenuous exercise also similar to that of coca. Then constitution, this is especially adapted to chronic diseases with syphilitic and mercurial history, complaints of old age or the prematurely aged with weak distended blood vessels. There is an increased ability to exercise without danger like coca, and is less affected by excessively heat of summer or cold of winter. Then thermally, as like most of the acid remedies, this is hot patient. Then regarding the cardiovascular system, this is mainly indicated in case of varicose vein and ulcers, obstinate and long-standing cases in women who have borne many children. It is also indicated in nervous splat of children, especially in the right temple, and also in cases of capillary aneurysm. So wherever there is a varicosity, varicose vein, ulcers, or capillaries that has been um, mm, dilated, or what we call as capillary aneurysm, the blood vessels distended, we can think about fluoric acid. This is the capillary aneurysm, just a picture that has been the nervous platters. For these conditions, fluoric acid could be given. And in skin, the old cicatrices, it become a break open, as like what we study in case of causticum and graphitis. Here also the cicatrices, it can become red around the edges, that is, it is becoming inflammatory and threat to become open ulcers. And if there is an ulcer, the cicatrices, and if there is an ulcer, there is a characteristic appearance of that ulcer. The edges will be very red, indicating that inflammatory condition, and also with vesicles. There will be copious discharge, and there is aggravation from warmth. We already saw that the patient is hot actually, so there is aggravation from warmth and amelioration from cold climate. There's also violent pain like streak of lightning confined to a very small spot. And in case of bones, there is like phosphorus silicea. This medicine will be affecting the long bones, causing its caries necrosis. So in tooth, we can see dental caries, and in long bones, there can be necrosis. In case of phosphorus, it was mainly the fossy jaw, the jaw bones being affected more. But here it is any kind of bones, especially the long bones. So, as like we say in case of mercury and also mesarium, all the syphilitic remedies, because their ultimate area of destruction will be in bones. So, caries and necrosis, fluoric acid is indicated of long bones, which is having a psoric or syphilitic miasm, abuse or the abuse of mercury or silica. It can be given for the caries of teeth, whether will be fistula dentalis or fistula lacrimalis in the eyes. There can be exostosis of bones of face. For the exostosis, generally another medicine which could be given is Hecla lava and also calcarea floor. So if there is an exostosis, we can think about Hecla lava and calcarea floor. Another medicine to think about will be fluoric acid. So this one, actually the initial, this seems to be much interesting actually. So fluoric acid, here Clark is giving a comparison of fluoric acid to silica. or silicea. Even in Kent, when we go, we can see such a comparison of fluoric acid and silicea. And we can see there is much similarity between them because both are acting on the bonds. So the fistula that is being produced or the necrosis, fluoric acid and silicea are much similar, and that is why these two drugs actually follows and also precedes well. So either we can give silicea before and follow to it fluoric acid, or fluoric acid follow to silicea. But usually the relation is pulsatilla silicea fluoric acid. Such a relation has been given by Kent also. Fluoric acid is useful after the abuse of silicea, that which we saw earlier also, mercury, silicea, where it has been abused, we can give case of, I mean, this one, fluoric acid actually. Uh, But the modalities of the two drugs are different. In case of silicea, the person is extremely chilly patient, but in fluoric acid, we saw that he is thermally very hot in nature. So the modalities of the fluoric acid and silicea get differed. Um, it acts on bonds, especially the long bonds. It means fluoric acid acts on the bonds, especially the long bonds, causing clearance and necrosis, and also favors the expulsion of the necrosed part. This is also something that we learn in case of silicea, especially the foreign body, not just necrosis. What we usually learn in case of silicea is if it is given for some foreign body that has been entered into our body, this silicea, when given, it has the ability to expel that thing from our body. Even that single feature, if that expulsion of that foreign body can also be done with the help of hepa sulf, but more is silicea. For the fistula, the rectal, dental, and lacrimal, any fistula of the rectal, dental, or lacrimal will come within the sphere of fluoric acid. Then there can be old cicatrices, which we already saw the nature. It can break open, and it can also become very inflammatory in nature, becoming red and with much itchiness. There will be small red spots or blotches that will be forming here and there. And everything, in case of fluoric acid, it is aggravated from warmth and amelioration in cool place. There can be red blotches also, which tend to desquamate. And the other important is like in case of nails, nails that which grow rapidly. But when we go towards the explanation of Kent, we'll see in case of nails of fluoric acid, it is much similar to the nails in case of antim crude. Somewhere it will be thick, somewhere it will be thin, so it will be very brittle in nature, easily breaking up, not growing properly, very unhealthy type of nails that which we learn in case of antim crude. Such a similar nails we can find in case of fluoric acid also. Even the teeth are affected. It is deficient in enamel. It will be very black and unsightly looking. Then increased sensitiveness of vision and hearing. And then there is a case which has been explained in J.H. Allen by in the J.H. Clark, which was given by T.F. Allen. And this has been recorded in this particular book, NAJH, I don't know the full form, showing the applicability of fluoric acid in Whitlow condition. So a lady spilled some of the acid on her hand, and though treated at once with turpentine, a few spots escaped on one hand. And these spots soon gave her great pain, intensely pulsating in nature. The pulsation involved the tip of the thumb especially, though this had not been touched by the acid. So the pulsation was mainly present, especially in the tip of the thumb, and in this area, the acid actually didn't fall actually. It was not red like the spots touched by the acid, but was very soft to touch, and when pressed, there was a sensation as of a splinter under the nail and in the cellular tissue. When we say that there is a sensation of a splinter, Some of the remedies which will come into our mind is Hepasulf, Silesia, Argentum nitricum. But still, the gave acid may be one thing. The causative factor was also an acid. Another one, there was a amelioration only by keeping the whole hand in cool open air, which was so characteristic of fluoric acid. So fluoric acid was given and it was efficacious or effective in curing that condition. And another case given in Clarkus in a workman whose hand was exposed to the fumes of the acid. There was intense throbbing pain, especially in the thumb. Suppuration occurred later and was very slow to heal. So some of the symptoms when we see that this condition can also be covered by silesia. So that is where the comparisons is coming up. One can follow the other or one can precede another. And according to McLachlan, I think that is how it is pronounced. The left hand is affected rather than the right, and the pulse tends to point on the dorsum of the finger. But I would say this is not that important. I better delete this sentence. So there is amelioration from cold washing, which distinguishes it from silesia. We already discussed that. Fluoric acid is also distinguished from silesia by the general amelioration from walking in the open air. We saw that in case of fluoric acid that they can survive the extremes of temperature and they will be very much comfortable to do any kind of physical exercise. They have got a lot of physical endurance or exercise endurance as like that of coca, which makes it the second difference between fluoric acid and silesia. So there is a constant, irresistible desire to walk in the open air. It does not fatigue. It's characteristic of fluoric acid. And when we say this sentence, there is an irresistible desire to walk in the open air. Then we come into the third medicine, which Kent will be saying and will be seeing later. And that remedy is pulsatilla. So that is how the relationship of fluoric acid, silesia, and pulsatilla coming up. So we see fluoric acid and silesia, which is very deep acting, even affecting the bones. But fluoric acid is extremely hot patient, and also and silesia is extremely chilly in nature. And when we come to pulsatilla, though pulsatilla is not having that much deeper action like the destruction of the bones, its carries necrosis, etc. It is not going as deeper into that area. But pulsatilla is also having a thermal reaction similar to that of the fluoric acid, that is hot or warmth is aggravation for them. Cool application is amelioration, and also amelioration from open air. There is a relation for fluoric acid to pulsatilla also. In case of fluoric acid, hunger predominates, not much important. However, there is aggravation from wine, like zingamet, especially from red wine, which is peculiar to fluoric acid. Uh, this one we have told increased ability to exercise without fatigue is less affected by excessive heat in summer or cold in winter. Then motion is aggravation. Cold drinks aggravates toothache, warm drink aggravate diarrhea. It doesn't matter even if you forget this. But here you see the person actually when we say that he can exercise his muscles without fatigue, and then there's the same contradicting symptom like motion is aggravating. So just go for when such contradicting symptoms like uh, contradictory, yeah, sometimes like ignitia contradictory, it's important. But this one is like what will we finally memorize for the exam or even to give to the patient is itself confusion for us. So I wouldn't say you to remember this motion aggravation. Just remember the peculiar symptom that they can physically endure any exercise, and also the cold is amelioration. That will be best to memorize for the exam purpose. Uh, then amelioration bending backward and bending head back, washing with cold water. Symptoms seems to go from below upward. suited to complaints of old age people, we saw that, or prematurely aged. Weak constitution was sallow skin and also emaciated. And this is this constitution, the people, the old age or premature old age. If you have seen, like, notice Materia Medica, you'll see all the medicines in which there is a excessive sexual desire, or the people involving in too much of masturbation or sex excessive indulgence. In all our medicines, we can see those constitution that will be given, like complaints of old age or prematurely old age. So wherever you see that type of constitution and you go into the details of those medicines, we can see there is a excessive sexual indulgence in their in their therapeutics. So that is that you can always connect it one way or the other. From the therapeutics, you can go to the constitution, or from the constitution, the other way around. Anyway, old age or the complaints of old age or prematurely old age looking, especially that premature old age looking, that will, can be connected to the excessive sexual indulgence. And that's what Clark has mentioned mainly. And going towards the details given by Kent. In case of Kent, he says that fluoric acid, it takes a long time for this remedy to produce some symptoms, even during proving. So when proving also, when this medicine was given, the symptoms were produced after a very long time. Excuse me. It is a very deep acting medicine, an antipsoric, antisyphilitic, and also antipsychotic. So trimiasmatic remedy is this, though it will be mostly showing its syphilitic or that destructive nature because it is the acid component. It is insidious in its action. Insidious means very slow in developing, and its symptoms are very slow in approach. It is like the deepest and the slowest and most tedious diseases, the miasm, and hence it is very suitable in the very slowest and lowest forms of disease. Which means that much deep acting, that much slow in producing the symptoms, all those diseases, this will be very much suited. If you remember, if we go for the typical example of syphilis itself, we know there are different stages of syphilis. There is a primary stage, secondary stage, then the person or the patient will be going towards the quiescent stage, then the tertiary stage. And the tertiary stage is mainly characterized by neurosyphilis and also cardiovascular syphilis. And it is told that sometimes the patient may not even develop in the to the tertiary stage. They will be getting just um, no, not tertiary, the quaternary. Quaternary, the patient may not even go towards the neurosyphilis or the cardiovascular syphilis because it will take a long duration. Before to that, patient may even actually die. And only few people will develop that quaternary symptoms or the stage of this syphilis. So like that, we can compare that or connect that to this symptom development in case of fluoric acid also. So such very slow, deep developing miasms or diseases are coming in the sphere of fluoric acid. It corresponds to overheated states of the system, old cases of nightly fevers. However, this feature, when we say overheated states, when Vinod was saying the case, he told that the main indication, one of the main indication which he remembered to give fluoric acid was this heat sensation that the patient was feeling actually. So this is highly characteristic. When we say overheated or old cases of nightly fever, it doesn't mean actually the person is having a temperature high like that of belladonna or aconite or such fevers where the temperature of the body is very high. But here, what Kent means when he says that there is an overheated state, that there is heat that is emanating from his body. That's what the Kent is giving the explanation. It's not a hyperpyrexia stage, But when we touch the body of the person, or from his body, a great warmth will be coming out. That sensation of heat will be there. That is the word meant by overheated sensation. It is an unusually hot-blooded remedy. In the evening and night, great heat seems to evolve from the body without increase of temperature. So it is not that a fever condition. We can't give fluoric acid for an acute fever condition or pyrexia, but the person will be having a sensation of heat or hot, and heat is being emanated from his body. That is what it means. The skin becomes very hot. The patient is often aggravated from warm things, from covering, from warm air, suffocates somewhat like pulsatilla in a warm room. So these symptoms are better also in the open air. And that is why we come into the relationship, as I already told you. Fluoric acid, it follows silicea. And we saw where is the difference between fluoric acid and silicea. One is extremely chilly and another one is extremely hot. And another one, they don't want to move about. They like to sit somewhere, silicea, because of their chilliness nature. But fluoric acid, they can move about. And they have that physical exercise endurance, etc. And you might be already knowing that silicea and pulsatilla are complementary to each other. So that follow, and silicea can follow pulsatilla. So that relation, according to Kent, it will be like can go like this, like what we learned: sulfur, calcarea, lycopodium. That's a series in which the medicine goes. So like that, another series which is given by Kent is this one: pulsatilla, silicea, and fluoric acid. um, there is much detailing by Kent how this body nature, especially the thermal tendency, that will change. So if you are interested, you can just go through Kent today, the fluoric acid, and Kent has actually very nicely mentioned how it will be changing, like fluoric acid to silicea and silicea to pulsatilla. In short, what Kent has told, I have told you, but in detail, you can read Kent if you want to have a very detailed picture. So fluoric acid, that patient wants to bath the face and head in cold water, and such bathing is grateful, but his feet burn and is put out of bed in the night. The symptom, what exactly we know too. It so disturbs the function that there are peculiar outward signs in the nail, hair, and the skin. All of these three things are imperfectly developed. So in case of skin, what we see is little incrustations here and there, and they don't have any tendency to heal. We already mentioned it is good for cicatrice, for keloid, and also even for the ulcers. And they don't have the tendency to heal. Um, a crust can form, but no tendency to heal. And when comes to so in the skin, we see the ulcers, incrustations, all these cicatrices with inflammation and no tendency to heal. When we go to the hair, we see that there is much hair loss. Hair losses its luster, it falls out. And if we are examining the hair under microscope, we can see that it is necrosed. The hair, it will become lusterless, it will be dry, the splits and also breaking. So any complaint with the hair, we can see that in case of fluoric acid. And in case of nails, another one, as I told already, like that of anti-improved, it will be crippled. There will be corrugations in the nails which are lengthwise. The nails grow too fast at some areas and not in uniformly. So in net effect, when we see the nails, it will be deformed and crippled. Too thick in some places and too thin in others. It will be breaking easily and brittle also. So like antimicrobe, even silicea, hepat, we can think about that. So that will be the nature in case of these three: the nail, hair, and the skin in case of fluoric acid. And when we always say the ulcers or anything on the skin is not healing properly, or it is not at all healing. And why that happens is, most of these affections, in case of fluoric acid, there is a tendency of breaking down of a slow character, or the circulation will be becoming very feeble or slow in nature, especially in the skin near to bone or cartilage. So there can be ulcers in this earlobe area where the skin and the cartilage is in close attachment. And also another one to say the skin very close to bones, that will be our tibia. So some ulcers, if it is developing over the tibia, because in those areas already physiologically bleeding is not that prominent, it is slow. And in case of fluoric acid, it will be again the circulation of blood in that area will become very feeble, especially where the skin is near to bone or to the cartilage. And then if the bleeding is not happening properly, it means the ulceration is never going to get healed. Then coming towards the mind, I told you in mind also they are having a very uh, immoral type of nature. So there will be mental depression and melancholy with great sadness in young men who have destroyed the nervous system by vicious practices or excessive indulgence in sexual things. It is particularly suitable for that disorder of the human economy where men have continuously changed their mistresses. There is a state in which a man is never satisfied with one woman, but he continually changes and goes from bad to worse until he is a debauchee. If a young man cannot keep away from women, he is not so bad off if he will keep to only one. But in this case, it is actually he is going to too many women until he stands upon the street corners, and in his lust he will even crave the innocent women that go to the that that is seen along the street. And fluoric acid is suited to such kind of people. So extremely this itself, by the way, Kent has given, you understand the kind of morality of that fluoric acid patient. He will be never satisfied with one woman, but many women is needed in in his nature. So in this condition, fluoric acid can be compared to that with picric acid and sepia. But in picric acid and sepia, because this is a initial condition of fluoric acid. Okay, so in this condition, fluoric acid will be comparable to picric acid and sepia, and you can see in case of picric acid. Have you learned picric acid?
Yeah, for the brain fart.
Yeah, the brain fog, that is mostly there is a complete nervous exhaustion in case of picric acid. That's another acid remedy, and the destruction is happening in the nervous level actually. So, when the fluoric acid has gone into such a level, when the person who has been involved in that much sexual indulgence in the initial stage, then also fluoric acid is indicated. But then he goes into a completely worn out condition. The Kent is comparing with picric acid and sepia. And picric acid, it is mostly, there is no much sexual indulgence over there, but there is a nervous depression, the nervous exhaustion is there. But in case when it compares, can compares with sepia, is comparing there is a particular feature which can be seen in fluoric acid and sepia, that is their indifference. Both the remedies will be having indifference. And but the reason and the way in which the indifference comes out is actually very different in nature. So um, an orderly man, that means a very decent person who considers his wife as a best friend, he would rather stay with her than go anywhere else. To him there is no place like home. But that's like a nice person, or not a nice person which who is not a fluoric acid. But the fluoric acid person whom we have described in this paragraph, if such a person he is coming to home, he doesn't want to be in the home, he wants to go somewhere else, he wants to go away from the home, he's disturbed at home, and everything annoys him at home, that he no longer loves his children as he once did, he needs fluoric acid. So in fluoric acid also, he is having the sensation, feeling of indifference towards the persons whom he loved best. So the same sentence we see in case of sepia also. But sepia, it is more related to women, and that is mainly due to the uterine complaint she is having. But in case of fluoric acid and in case of sepia, we get that symptom that there is a indifference. And in both the indifference, the manifestation, the indifference are same. They don't want to be away, and they don't want to go to home, and they don't like children, they espouse anything. But the reason why this indifference develops are two different things. So, fluoric acid has with this state an overwhelming sexual erethism. He is kept awake night by erections. The state of desire forces itself upon him not only when he is with the opposite sex, but at all the times. So this patient, coming back to his generalities, they crave pungent, spicy, highly seasoned things like that of Nux vomica. And this drug is also suitable in the dropsy of drunkards. We already told it is a good alcoholic remedy. So you might have now got the picture of a fluoric acid person. A fluoric acid in his young age, he was very alcoholic, completely immoral in nature, not satisfied with one woman, too much satyriasis, and that growing, affecting his even the mental level where he goes into indifference, similar to sepia, but the causes are two different things, two different matters. In sepia, it is mostly female thing and also uterine related complaints which lead to the indifference. But in fluoric acid, it is the too much indulgence with the sexual things that he doesn't want to be at home or he doesn't like to be with children. And then from that immoral nature, it then going to the level of maybe that immorality itself brought him that syphilis or that conditions where the bones even are affected, where we see there is caries, fistula, then ulcers, everything that is being non-healed. And one of the most important reason is wherever it is present, I mean, there's ulcers or fistula, all these areas, they're non-healing because the bleeding or the circulation in those areas will be very much reduced, and that results in this non-healing type of ulcers. Then regarding the skin, we can give it for the cicatrices, keloid, whatever. And then we saw they are having a tendency like a extremely hot temperature patient or hot patient, and they want everything cold. That physical endurance can go to any level by doing exercise. They don't have any problem with that. Um, but such a person finally ending into a completely um, destructive in nature. Even the bones, the skin, the hair, the nails being affected. That is fluoric acid. And then in case of relationships, fluoric acid is complementary to coca and also to silesia. We saw how that comparison is being made and follows well. This is actually given in keynote actually. And this is very important in case of exam, especially for the MCQ, uh, these relationships. So you need to study this. It will be helping you clinically also, but also otherwise for MCQ, this is very commonly asked. So fluoric acid can be given after us in ascites of drunkards, after to calicarb in hip disease, after coffea and staphy in sensitive teeth, after phosphoric acid in diabetes, after silesia and symphytum in bone diseases, and after spongia in goiter. And spongia in goiter, all the other symptoms we have mentioned, but spongia, oh, the goiter we have not mentioned over here in fluoric acid, but that's also important after spongia in goiter. So that is about the three drugs we studied today, the fluoric acid, Ficus indica, and also Ficus religiosa, the two being hemorrhagic remedy and one being affecting